All right. So the following are phases of mitosis, except prophase, anaphase, metaphase, genophase, and telophase. Of course, it is genophase. At least everybody should get this one. Um, it's obviously the odd man out. PMAX. So it's not a valid phase of mitosis. Okay, the next question. The next question says patient with recurrent paleness of fingers in the cold and fibrosis or thickening of skin, which organ is affected? Option A, intestine, stomach, esophagus, duodenum. First of all, what's the diagnosis of this thing you're seeing here? What diagnosis are they playing at? And then what's the name of that syndrome? Well, there's Reynolds phenomenon, but what connects what they are describing there and the esophagus? What connects them? There's a syndrome. Is it not this one that is crest? Is it not this one that is crest disease? Okay. So it's the esophagus. Find out the meaning of crest disease. Crest. The E in this crest is esophagus. So they'll be having dysphagia and so on and so forth. All right. Patient with fever, abdominal pain, dysuria. What differentiates acute pyelonephritis from cystitis? Someone should inform other candidates that we've started. You guys should attempt the question now so that we move. This is a simple question. Both of them are UTIs. Cystitis, UTI of the bladder, pyelonephritis in the kidney, uh, urethritis, UTI of the urethral tract. They are all UTI, but depends on where it's happening. So what do you think will happen will be different from the cast in the kidney and the cast from the bladder? So that's just a simple question they're asking. On your
Chief, please, you can't see the question.
on others can see it. On your this thing. Okay, I didn't post it.
Yes, sir.
I posted it on the, what do you call it?
Whiteboard.
On the whiteboard. Okay, so of course it's white blood cell cast. The cystitis will not produce white blood cell cast. Anytime you see cast, you know that it's most likely something that is coming from upper. Okay, hyaline cast from CKD, red blood cell cast from glomerulonephritis, white blood cell cast from pyelonephritis. Just the cast tells you what's going on, but tells you that it's coming from higher up. Substance is tested at same GFR and urine volume. Plasma concentration increased, which has increased clearance. Mannitol, urea, creatinine, penicillin, phosphates. Basically, you are looking for the substance that is not going to be reabsorbed, because if plasma concentration increases, urine clearance will also be increased, which means it's just going out. It's not being reabsorbed. Many of these substances are going to be reabsorbed. Creatinine is going to be reabsorbed. Urea is going to be reabsorbed. All this stuff, one way or the other, are going to be reabsorbed. But mannitol is supposed to be clear. That's why it's used as a form of diuretic, especially like in cerebral edema and things like that. Basically, absorb the water and then gets cleared together with the water because it's an osmotic agent. Next question is about hair growth. Um, Hair growth occurs in which phase? Telogen, anagen, catagen. So the active growth phase of hair growth is anagen. True about coronary artery, except left circumflex is a branch of LAD. LAD arises from left coronary sinus. LAD is a branch of LCA. RCA dominant in 50%, LCA dominant in 20%. Left anterior descending. Left anterior descending arises from the left coronary sign, which is true. Left anterior descending artery, of course, is a branch of the left coronary artery. Right coronary artery dominance. Some people say 50, some people say 70, but like varies from 50 to 70%. I use 70, 20, 10. So the majority is for right coronary, which means right dominance, 20% left dominance, and then the remaining 10% co-dominance, which means both are sharing it. So the only odd one there is option A, left circumflex. It's actually a branch of the left coronary artery. I've shown you this diagram before. You can go and reference it. So option A is the answer. Primordial prevention of hypertension includes A. Training health workers on BP measurement in children, exercising in secondary schools, regular BP checks at home. So in prevention, we have primordial, we have primary, secondary, and then tertiary. So primordial is preventing the risk factors from even happening. Okay, so you go back in time and educate people on how to um, live a healthy lifestyle, exercise, eat proper diet. And so you are actually doing primordial. So which of these are associated with hypopigmentation of hair, except oculocutaneous albinism, Cartagena syndrome, selenium deficiency, copper deficiency, iron deficiency? So Carcinoid syndrome will cause ciliary dysfunction, not hypopigmentation. Concerning digitalis, except higher dose decreases refractory period, decreases excitability at therapeutic doses, increases excitability at toxic doses, decrease heart rate via vagal stimulation. So digitalis actually increases the refractory period. Digitalis is also digoxin. Remember that digoxin has a narrow therapeutic range. Blood supply to the lungs, thoracic aorta, third pharyngeal arch, intercostal artery, sixth pharyngeal arch. This question is testing your knowledge of embryology. So a sixth pharyngeal arch that the pulmonary arteries come from. Embryological origin of cerebellum. In all this, I hope you have finished the questions in your West Africa course. The questions, the way they are arranged, anatomy, physiology, biochemistry. I hope you have finished all those things. There's nothing that we are doing here that hasn't been done. Metencephalon, okay? Differentiate between HIV-1 and HIV-2. Of course, it's VPU. It's found in HIV-1 but not in HIV-2. Tuft of hair in lumbar region, rachis, hairy nevi, spider bifida or quarter. Of course, spinal bifida. Dry tap in acute leukemia, reticuloendotheliosis, packed bone marrow, Fibrosis. Packed bone marrow due to malignant infiltration. Hypopigmented lesion that is hypoaesthetic. This one is baby question. No market woman know this one. Why are you wasting time? They see hypo anesthesia, you are thinking about it. What are you thinking about? Is there another option there that makes any sense? Of course, it's leprous. All right. A young woman sexually active with STD symptoms, VDRL positive, FTA, ABS negative. What investigation is needed? So when you see, they're just painting a picture of someone who is sexually active. VDRL is positive, and you know that VDRL is a screening test. So you need to confirm it by doing specific tests like FTA, ABS. So when that one turns out negative, it means it is a false positive test for syphilis. And there are a lot of diseases that can cause false positive. And being that this woman is sexually active, because rheumatoid, SLE, all those things can cause false positive. Okay, but being that she's sexually active and all that, so you consider HIV. Female with recurrent cystitis 4 times in 12 months. What advice would you give her? Precoital micturition, antibiotic prophylaxis, use of spermicide, vitamin C. And the best answer will be to give her an antibiotic. That will be your best line of action. Clinical scenario depicting malassezia for which skin layer does it affect? Dermis, epidermis, sebum, gland, cutaneous tissue. The epidermis affects. Man weighing 80 kg with height of 1.5, BMI classification, overweight, normal height, um, normal weight, underweight, obese. How can patient be underweight? Did you calculate it? Or you're just choosing an arbitrary answer? When you see a question like this, you should know that you have to calculate the BMI, kilogram per meter square. So when you calculate it, you know what you get. Then you now classify it based on the normal BMI classification. Even the obesity has grades: grade one, grade two, grade three, and then morbid obesity. Grade 3 is morbid. So patient is already grade 2. What's the BMI? What did you get, Abdullah? Yeah, 35.5. Cervical syringomyelia, what's associated abnormality? Neurofibromatosis, anal malformation type 1. Only two options. There are only two options. 50-50. So pick one. Even if you roll a dice, it must fall in. It must be head or tails. Even if you don't know anything. Like if you pick one, it will be head or tails. Anal malformation. Female with worst headache of her life. CT shows subarachnoid hemorrhage, oral nimodipine, oral mannitol, oral aspirin, oral nicardipine. Which one would you use? I've told you everything already. I'm telling you the CT findings. So they left nothing to chance. It's just for you to pick the drug, which is nimodipine in this case. Elderly patients, hypertensive, with dizziness on standing, BP 80-50. What's the next step? You have to admit the patient because the patient is already dizzy. If the patient was stable, you consider the medications. When the patient is experiencing polypharmacy, so we have to reduce their medications. But In the meantime, because of the hypotension, need to admit. Lab findings: low iron, low TIBC, high ferritin. What anemia? IDA, anemia of chronic disease. When every other thing fails you, the major indicator of an iron deficiency anemia is high total iron binding capacity. So once you see that it's low, then it's not iron deficiency anemia. Primary step in DKA management: insulin, fluid, potassium correction, bicarbonate. Once you see DKA, do fluid therapy first. ECG shows AFib, which anomalies are present: absent P waves plus irregular, prolonged PR, irregular. Next question: ECG features of hypokalemia: QRS of 0.1, tall T wave, PR interval 0.5, and U wave. There's no exam you go for that you will not see questions in ECG. This one is on hypertensive patients, ECG findings that shows end organ damage. Can read the options. Option C. Patients with abdominal painless swelling is PKD. Which chromosome is involved? Read the option. Option B. Chromosome 16. Patient with fever, headache, Kenny sign, and CSF microscopy. Likely pathogen. It's meningitis. We keep solving these questions and you guys keep filling questions. We've solved these things before because they repeated questions from a different year in another year and you are seeing it again and you are not getting it. Likely patient with ring enhancing lesion and cat exposure. Patient with uveitis. Mechanism of action. Antigen from sanctuary sites. First recognizable ancestor of RBCs, aka precursor. Proerythroblasts. Cytokines in erythropoiesis, except Start looking for is odd. It's not involved in erythropoiesis. Post gastrectomy, patient with cognitive decline and anemia, likely cause. Okay. Plus is vitamin B12. The last question for today will be on RBCs. Um, they lack eukaryotic feature. Which eukaryotic feature do they lack? Nucleus, mitochondria, ribosome, Golgi. Red blood cells are very selfless in the sense that even though they are meant to transport oxygen through the heme, to these tissues, other tissues, they themselves do not consume oxygen. So they don't have mitochondria. That way, they don't get to process the oxygen. Maybe they would have been uh, using up the oxygen they are carrying if they had mitochondria. So it was thought best to switch off mitochondria, and then they can now carry the oxygen and go and deliver it without